Hi, everybody. I wanted to welcome everybody to my presentation that I put together for everybody. The title of my presentation this week is Improving Care of Alzheimer's Patients. Hope you enjoy it. So the bill that inspired this presentation was S.2076, the acronym BOLD, Infrastructure for Alzheimer's Act. This bill was sponsored by Susan Collins, a Republican from Maine, and the goals of the bill were to, one, reauthorize a previous bill that was similar to what this bill was trying to do, with some changes that I'll discuss. Also, it was to promote increased knowledge and education related to Alzheimer's and to actually dementia as well. Um, and also to promote implementation of evidence-based research, which is actually spelled out in the bill itself. Um, Also was to increase support for caregivers, which I found after doing some research really suffer almost as much as the Alzheimer's patients in some cases. And I'll kind of go over that. And also to increase funding for implementation of this bill. So based on the research that I did and the bill that I was basing this on, the proposed practice change that I'm presenting today is implementation of nursing interventions in a home setting related to promoting good sleep habits in Alzheimer's patients and their caregivers. And the thesis statement that I am making is that while other factors could also contribute to Alzheimer's patients and caregivers' failure in the home setting, better sleep habits in Alzheimer's patients and caregivers lead to better outcomes. Lack of sleep results in higher numbers of mental health issues, increased health issues in caregivers, and also increased admissions into skilled nursing facilities. So the learning objectives that I'm trying to achieve with this presentation is, one, to give you guys a little bit of a history on the legislation related to Alzheimer's, talk about some of the challenges that caregivers have with Alzheimer's patients, especially related to sleep, and then new research related to the sleep in Alzheimer's patients and the caregivers, as well as what my proposed nursing intervention is. I hope you guys get that. So to give everybody a little bit of history on this bill, it's actually part of multiple levels of amendments that came out of the actual original bill, which was the Public Health Service Act. This bill had been passed originally in 1944 and kind of revolutionized public health in our country. One of the major accomplishments that I was reading about when I was reading about this bill was that it had addressed tuberculosis and the pandemic that it was creating back then, which I found ironic considering where we are today. But like I said, there were many amendments that came into this bill over time, and to get to where we were today, with where this amendment was passed on December 22nd, 2018. And the thing that changed in this bill was that it became more than just about Alzheimer's. It ended up including dementia into a lot of the wording of this bill to kind of really address the bigger problem that was both in those two different populations. Also, it had a really strong emphasis on implementation of evidence-based research, and that's right in the wording of the bill, which I found very interesting and refreshing, actually, that it was promoting that in terms of shaping public health. Also, there was a really strong emphasis on supporting caregivers. A lot of the research that I was reading about spoke about some real issues related to caregivers in terms of taking care of these patients. And so there was a lot of emphasis on trying to figure out ways to help them out. And also there was a part in there about evaluating the cost of the bill as well as increasing the financial support. Originally, the bill before this amendment was talked about $5 million every fiscal year, and this one upped the ante up to $20 million. So some of the challenges that I was reading about as I was going through the research surrounding this issue was one, that mental health issues, not only for patients, but for the caregivers. They found that the caregivers also had a really increased level of anxiety and depression, as well as some real serious health related issues for the caregivers. They found an increased level of cardiovascular issues, hypertension, obesity, and actually a very high level of dementia in these caregivers as time went on. They kind of related this issue to the fact that these caregivers had higher levels of interleukin 6 and also cortisol levels in their blood work. So I know the stress that Alzheimer's patients have to deal with through my interaction with them at work. It's a very sad and hard thing for someone who's even sort of self-aware to the point where they know that it's happening. But I was not aware of how hard it was on the caregivers. And so really what it came down to, as people are looking into the root causes of some of these health-related issues, a lot of it came down to the fact that they're not sleeping. So they found in one study that 91.7% of the caregivers reported that they were having poor sleep, which is a lot of people. So as I was looking into this and finding the research on what could we be doing as nurses to help improve these situations for the patients as well as the caregivers, was that they found that physical activity really has a correlation to better sleep habits. In one randomized control study, it showed that there was a significant benefit not only to sleep, but to cognition when patients were put through more physical activity throughout the day. Also, they had one study that talked about something called multisensory stimulation. So in this trial, they found that through this process, not only were people able to reduce stress and promote relaxation in these patients, but it also helped in the long run with the caregivers and the results that they were having. I also found a really good resource called Alzheimer's Association. So that's a group that's been put together to support patients and the family members in terms of going through dealing with Alzheimer's patients. There was a lot of stuff in there in terms of stories that people have kind of experienced, resources for people to reach out to help them deal with the situation, as well as some research that was in there. And one of the research articles that I had read in there talked about how daylight savings times really is a terrible thing for Alzheimer's patients. I mean, we all, as just people not dealing with that, I know that myself, I really struggle when we have to move those clocks around. And it talked about that really causes an issue for Alzheimer's patients. And so there was some ideas and interventions that could be put in place in terms of not really changing the clocks, dealing with it in terms of keeping lights on longer at night to deal with figuring out a way to keep people from getting more confused as the evening. So when we consider the nursing implications in dealing with this situation, and we think about the nursing code of ethics as well as our scope of practice, I think that really part of being a nurse in our ethics code talks about providing compassionate care to patients and families, helping them with their sleep habits is definitely falls within that. Promoting advocacy for patient health and safety by remaining home instead of having these individuals move into different healthcare settings like nursing homes. I think that by them remaining home, it truly promotes a better environment for them. And also advancing our profession through the application of evidence-based research. That's what we should be doing as nurses. And also falling within our scope of practice is the intervention. We do interventions based on educating and supporting healthy lifestyles in not only our patients, but their families. So as far as stakeholders and financial implications, so the main stakeholder are going to be the caregivers and their families. And when we start talking about the costs associated with that, you start thinking about not only is it costing the caregivers in terms of time away from work, having to care for these patients, but also the health bills that are going to come out of these comorbidities that they're creating through this caregiver burden. So if we were able to bring that forward and show that to not only the insurance companies, but to Medicare and Medicaid providers through some research and showing that cost analysis, I think that we could get these people on board. Also, I was reading some research about the costs associated with the hospitalizations of Alzheimer's patients. When family members kind of get to their wits' ends, that's what ends up happening. These patients end up being hospitalized, and inevitably that ends up turning into a situation where these patients end up in skilled nursing facilities. Also, the cost of long-term care versus home care. I know from myself working at a skilled nursing facility, the day-to-day costs associated with someone staying in a facility like my own is a lot. And that expounded over a month's time just continues to grow. So home care is definitely the way to go. Even if you're having to care or pay for someone to maybe be there at night with the patient to help people sleep, and also for the time that a nurse might need to be there to implement the interventions that I'm talking about in terms of going in and educating family members on this research that would help. So if we're talking about the cost analysis of this intervention, which would be the nurses going in and doing education on these families to help them get some better sleep, we're talking about maybe the increased costing of the nursing care, right? So the nurses go in there, they're spending some time in there, you're going to have to pay for that. But then on the other side, you have a decreased cost of healthcare for patients and their caregivers, which could be significant, way more than what you're going to pay some nurses to go in there, and not only for that first education, but to kind of keep going in and reinforcing and support and see how everybody's doing and to kind of survey it. Also, you're going to have the decreased cost of not having to put people into long-term care placement. And then you have to talk about the emotional costs, so you have decreased depression and anxiety in these patient and caregivers by improving their sleep and avoiding long-term care. Also, you're going to have increased level of care by having nurses in there who will be able to maybe catch some other issues that might be developing with these patients, as well as increased well-being of everyone involved, which is what we should be doing as nurses. So as far as how we would see if this is really working, we would do a collection of data through a survey process. Maybe we would have our questionnaire at the beginning and then a questionnaire at the end, which would focus on sleep, mental health, and physical health of those involved. And then we could do a cost analysis post and prior to the intervention as well. So in conclusion, I just want to bring back the focus on the fact that there is this bill that is promoting exactly not what I'm saying, but a roundabout would promote this. Also, the effects of Alzheimer's on patients and caregivers is extreme. There is also ongoing research to promote more evidence and interventions in the future. Also, the importance of nursing-based interventions to help these patients and their families. Thank you very much for listening.